I'm going to yield myself such time as I may consume for an opening statement. I will try to keep it within the 5 minutes. This is a very important topic and important to me personally. Our national debt is approaching $35 trillion. These are stunning statistics and should be sobering for every American. We're adding $8 billion to the debt every day. Our gross debt to GDP is over 123%, which is higher than it was when we were fighting a world war and we're in relative peace and prosperity. We're in a bad way in terms of our nation's fiscal health, and it is rapidly declining. Even worse, so far this year, we're paying almost 60 cents on the dollar just to service the debt. That's the interest on the debt, which, by the way, this year will exceed what we spend on all of national defense. There are also payments thus far this year. Our interest payments to date this year are more than we spent on Medicare, as well as our national security for this great nation. Hard to believe. In order to reverse the curse, we must address the biggest driver of our debt, federal health care spending. In fact, the Congressional Budget Office projects the spending on major health care programs will nearly double and grow from $1.7 trillion in 2024 to $3.2 trillion in 2034, 3 times larger in 10 years, federal health care spending, than what we spend on national defense. National health expenditures, which include everything from patient out-of-pocket costs to federal and state spending on major health care programs, are projected to grow faster than our economy over the next decade, rising from $4.5 trillion, or 17% of total economic output, to 20% of our economic output, or GDP, and would be over $7 trillion. Healthcare spending is expected to grow at 5.4% over the next 10 years, while GDP is going to grow, projected to grow at 4.6. Simply put, this isn't sustainable for the federal budget. It's not sustainable for patients, nor is it sustainable for our taxpayers. This hearing today is important. We're going to focus on one of the key issues plaguing our broken healthcare system and driving increased federal spending, which is increased consolidation in healthcare markets. Big medicine, as I like to call it, big medicine consolidation across healthcare markets, ranging from hospitals purchasing independent physician offices, we'll delve into that, to insurance companies acquiring pharmaceutical benefit managers, and even pharmacies themselves down the supply chain. And we have other trends. But the data spells out a troublesome picture of the current state of healthcare markets and the impact of consolidation on spending. In fact, CBO stated that consolidation has increased federal health spending and cost for patients while limiting their choices and decreasing patient access to quality care. There were over 1,000 hospital mergers between 2002 and 2020, and research has revealed the average price of hospital services increased in that period of time by $521 after hospital mergers occur. Additionally, 41% of physicians are now vertically integrated with a hospital or health systems, an increase of 12% over 10 years. In cancer care alone, over 700 independent cancer clinics were acquired by hospitals over the period of 2008 to 2020. The cause and effect of this is clear. Prices for physician services in areas with high market concentration are between statistically 14 and 30% higher than in areas with less consolidation. In the prescription drug supply chain, 79% of all drug claims are now processed by 3 pharmaceutical benefit managers, all of which are vertically integrated into large health insurance companies. This vertical consolidation, which some will say is greater scale, greater efficiency, bringing costs down, is actually shifting incentives and increasing drug costs for Americans. The House Budget Committee and the House Republican Conference have been leading the way to combat healthcare consolidation through policies in our Reverse the Curse Balanced budget, such as site-neutral payment reform. which is, by the way, a Democrat and Republican idea. I think it actually emanated with President Obama, but we agree with it. Equalizing payments for the same service through Medicare site neutral reform while ensuring our rural providers are unaffected is not only common sense, it would save taxpayers over $150 billion in the 10-year budget window. More importantly, this policy would end the perverse incentive that's leading to hospitals acquiring independent physician offices, leaving the market with less competition, patients with fewer choices, and then most importantly, our reform would ensure seniors will pay less out-of-pocket costs, and we believe that's the bottom line here in terms of our success objective. Lastly, the House Republican Lower Cost, More Transparency Act passed the House in December. Not only includes transparency reforms to improve healthcare markets, it also included a site-neutral payment for Part B physician-administered drugs. So we're moving in the right direction, in my opinion, for sure. As chairman, I've made it clear this committee takes its fiduciary duties to our taxpayers seriously, both Republicans and Democrats, and which is why we're going to examine the effects of rising consolidation on the budget and discuss reforms necessary to reverse this trend, restore market competition, reduce healthcare spending ultimately for the American people. That's what we want: access, lower costs. Nobody can afford healthcare at this point, and I know we're all working towards that stated objective. With that, I yield to my ranking member and friend from the Keystone State for his opening remarks.